So yes, you can see focal seizures in MS. I have other videos on this, but it's been a while, so might as well review. MS is a neurological condition in which the myelin that codes your neurons is stripped, leading to what we call demyelination. It shows up like this on MRI, and it can also affect the spinal cord. Those long white lines that you're seeing on the spinal cord, not the one that's surrounding it, that's the CSF, but in the middle, those are MS lesions. Your brain cells, and also your CNS cells speak with each other using neurons. Myelin is like the insulating sheet that covers these neurons. Think of it as like the rubber coating around a power cord, right? Like a toaster, a curling iron, you're going to have rubber insulating. So that's what myelin does. It helps keep that electricity insulated. It also helps communication because honestly, for most neurons, the transmission goes from node-afferent VA to node-afferent VA, which is the little gaps in between the myelin sheets that are shown up. We call this saltatory conduction. Those are the red arrows. That's the electronic transmission going from node-afferent VA to node-afferent VA. Again, nodes of VA are the gaps in between your myelin sheets. But if you don't have the myelin sheet, there's really no way for those electronic signals to get across. And that's the issue with demyelinating lesions like MS. The electronic activity in your central nervous system, which includes your brain and spinal cord, gets messed up with MS because there's no proper way to have that signal conduction through neurons. So it can present in a variety of symptoms as shown in this diagram. This also includes seizures. This is from the Epilepsy Foundation. Focal seizures are actually not uncommon in patients with epilepsy. About 60% of them will have focal seizures. The most common that I've seen is focal seizures without impaired awareness, so you're aware you're having the seizure, but you can also have focal impaired awareness seizures. If your disease progresses or your seizures are uncontrolled, it can always progress to focal to bilateral tonic-clonic. The best way to treat seizures with MS is good MS control. This is what we call secondary seizures, right? Because you weren't born with epilepsy, you had the MS, and because of the demyelination, now you have seizures. So if your MS is controlled, generally the seizures are as well, but you do need to use seizure medication. And of course, this doesn't apply to everyone. I've also seen patients who have epilepsy and then also developed MS, and now they have seizures because of MS and the epilepsy that they were born with. So truly, the diagnosis and the treatment should be a tailored approach. If this is something that you are dealing with, definitely see an epileptologist or a neurologist who's trained to see someone with seizures. I think that's going to be the best way to get the tailored help.